Wisconsinites ages 16 and older with certain medical conditions are now eligible for the COVID-19 vaccine. This list includes 20 conditions such as asthma, cancer, heart conditions, obesity, liver disease, and diabetes. The conditions are associated with an increased risk of severe illness and death from COVID-19. This group includes another 2 million people who are now eligible in the state, and the rush is on to get vaccines in their arms.
Naomi Coles talked to several newly eligible people who are navigating the scheduling maze. Naomi?
In theory, there are a lot of ways to get the COVID-19 vaccine, places like your healthcare provider, pharmacies, vaccination clinics. However, in practice, it can be a whole lot harder.
Such a relief. There was a little bit of crying.
Amy Sherman Courtbine drove from Middleton to Milwaukee's Wisconsin Center with her son to get vaccinated last week, getting a welcome jump on Phase 1C. Her husband gets his tomorrow at Walgreens.
I'm a realtor, so I've been working, outside the home.
Monday morning, a COVID vaccine hunting Facebook group she's part of was full of questions, tips, and vaccine availability alerts. That's the sounds of about 2 million more people becoming eligible through underlying medical conditions in Wisconsin and looking for appointments.
It's just this process. It's tough. It's our first pandemic.
Newly eligible in 1C, Julianne Hofarth tried her employer, her healthcare provider, and multiple pharmacies without success. Her friend woke her up with a text Saturday morning. There was a slot at Walgreens.
Set up and I'm ready to go for tomorrow, so it's really exciting.
Navigating that web of open slots through various pharmacies and providers can be tough.
So every place is different, which is why it's so hard for everyone, right?
We first talked to Bob Orrick a week ago about the group he helped found.
And it's not just some secret way through our Facebook page. It just really helps guide people.
Now he says they're growing at a pace of 1,000 people every couple days.
It's really about just getting people in contact with the right organization, the right retailer, the right healthcare provider.
And even after getting vaccinated, people are still giving back.
I have not had anybody that I haven't been able to get in.
And honestly, everyone is jumping in to help one another. So that's what's really making this easier.
So besides this group, here's a few places to check. First, of course, your local healthcare provider, plus large pharmacies like Walgreens and Walmart. But don't forget your local places either. Other options include community clinics run through local health or other organizations, or a mass vaccination site. We have more info on our website about where and how.